Yeah, it's a good
Yes.
question. So in certain conditions, before going to initiate insulin,
Insulin is never the first drug of
Yeah.
option. Metformin.
first drug of choice in type 2 diabetes is metformin, and when it is associated with atherosclerotic cardiovascular disease or uh, already having heart failure, we initiate with SGLT2 inhibitors. We add on SGLT2 inhibitors or GLP-1 receptor agonists or combine both to give organ protection according to ADA or AST guidelines.
Then we go to insulin.
Then, if not controlled, we go to insulins or other agents. And how to treat brittle diabetes in elderly? Ambaram Brangarasan. So,
You have to go to multiple OADs along with the coformulation.
so
Usually
brittle
we don't
diabetes
see-
is a very big topic.
It's seen in type 1.
Usually seen in type 1 diabetes, and this should be taken care with multiple with continuous glucose monitoring or SMBG method, and adjusting the insulin doses and the diet, exercise, various factors are required, and lot of counseling is required to treat the brittle diabetes.
Brittle diabetes is rarely seen in type 2 diabetes.
Brittle diabetes is rarely seen in type 2 diabetes. It is usually seen in type 1 diabetes, usually at the time of puberty due to the hormonal surge. Usually we see the brittle diabetes, and
Can you unmute that?
when other hormones are also affected, like hypothyroidism and certain other hormonal
Can answer better. No
disharmonies.
No one will.
So
You
we
can
see the brittle diabetes,
Answer
and
better.
certain patients they
Classmate.
take with irregular food habits and irregular treatment. We see the brittle diabetes. It is very difficult to manage, but with lot of counseling and with the minimal dose and frequent monitoring of blood glucose, we can manage the brittle diabetes. So in this case, elderly, we recommend iodine gas which has low hypoglycemia, and we avoid sulfonylureas to prevent hypoglycemia in these cases. Thanks, ma'am. Garima. Arun.
Am I audible?
Am I audible?
Dr. Azdeep. Dr. Azdeep said
Can you unmute me?
there is no facility to
So
unmute.
there is no facility to unmute Rajiv Srivatsa.
Attendee, we cannot unmute. Attendee, we cannot unmute here. You can chat from your end. Doctor is ready here to give any number of answers asked by audience.
Yes, audible. Durga Prasad.
Yeah.
Thank you.
There are any questions?
If you have any questions, please put forward your questions here. We are waiting for another 2 to 3 minutes. After that, we are going to close the session. We are requesting all the audience to put forward your questions. Thank you. Thank you one and all for your patience listening. Thanks once again for today's evening speaker, Dr. Tirumala Madam Garu. Even she is busy with evening schedule. She has taken out time and she has given wonderful lecture on given topic. And thanks all the audience even for your valuable participation. Thank you. I am going to close the session now.